Question 1. A 55-year-old man collapses in front of you. You ensure the scene is safe and check for responsiveness. He does not respond. What is your immediate next action? A. Begin chest compressions. B. Check for a pulse and breathing simultaneously. C. Call 911 or activate the emergency response system. D. Open the airway with a head tilt chin lift. Answer: C. Call 911 or activate the emergency response system. The concept here is the initial steps in the BLS sequence for an unresponsive adult. After ensuring scene safety and confirming unresponsiveness, the most crucial next step is to activate the emergency response system, often by calling 911, to get professional help on the way. The keyword immediate next action emphasizes the priority of getting help. Prompt activation ensures advanced life support can arrive quickly, which is vital for survival in a medical emergency. For instance, if you're alone, you'd use your phone to call 911 and put it on speaker while you proceed with other steps. Remember, getting help en route is always a top priority after ensuring the scene is safe and the person is unresponsive. Question 2. When performing chest compressions on an adult, what is the recommended depth of compressions? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters. D. At least 2.4 inches 6 centimeters. Answer: C. At least 2 inches 5 centimeters. This question tests your knowledge of the correct depth for chest compressions in adult CPR. The guideline specifies a minimum depth of 2 inches 5 centimeters but not more than 2.4 inches 6 centimeters, making at least 2 inches the most accurate choice for effectiveness. Delivering compressions that are deep enough is critical because it helps pump blood effectively to the brain and other vital organs. Imagine trying to squeeze a tube of toothpaste. You need enough pressure to get the paste out. Similarly, compressions need to be deep enough to circulate blood. Always push hard and fast. Question 3. What is the correct compression to ventilation ratio for a single rescuer performing CPR on an adult? A. 15 compressions to 2 breaths. B. 20 compressions to 2 breaths. C. 30 compressions to 2 breaths. D. 30 compressions to 5 breaths. Answer: C. 30 compressions to 2 breaths. This question focuses on the correct ratio of chest compressions to rescue breaths for a single rescuer administering CPR to an adult. The standard ratio is 30 compressions followed by 2 breaths. This specific ratio balances the need for continuous chest compressions, which are paramount for blood flow, with providing oxygen to the lungs. For example, after delivering 30 compressions, you would quickly deliver 2 breaths before resuming compressions. Make sure to minimize interruptions in compressions to ensure the best possible outcome. Question 4. After an AED delivers a shock, what should the rescuer do next? A. Check for a pulse. B. Turn off the AED. C. Immediately resume chest compressions. D. Wait 2 minutes before resuming compressions. Answer: C. Immediately resume chest compressions. This question tests the crucial action following an AED shock. The guideline states that after an AED delivers a shock, rescuers should immediately resume chest compressions without delay. The keyword immediately highlights the urgency. Prolonged interruptions in compressions significantly reduce the chances of survival, so continuous, high-quality CPR is paramount, even after a successful shock. Think of it this way: the shock resets the heart, but it still needs help pumping blood, so you restart compressions right away. Keep pushing hard and fast. Question 5. When should you activate the emergency response system, e.g., call 911, for an adult victim who collapses? A. after checking for a pulse and breathing for 10 seconds. B. After performing 2 minutes of CPR. C. Immediately after determining the victim is unresponsive and not breathing or only gasping. D. Only if you are unsure what to do next. Answer: C. Immediately after determining the victim is unresponsive and not breathing or only gasping. This question addresses the timing for calling for help for an adult. For an adult who collapses, if you find them unresponsive and not breathing or only gasping, you should activate the emergency response system right away. The key phrase "immediately after determining" emphasizes that this step is critical and should not be delayed by starting CPR first, especially if you are alone. Getting professional medical help en route quickly is a vital link in the chain of survival for cardiac arrest. For example, if you see an adult collapse, check for responsiveness and breathing, and if they're not responding, grab your phone and call 911 immediately. Question 6. What is the recommended rate for chest compressions for all age groups, adults, children, and infants? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. 100 to 120 compressions per minute. This question is about the universal rate for chest compressions across all age groups in CPR. The recommended rate for compressions is 100 to 120 compressions per minute for adults, children, and infants. Maintaining this consistent rate ensures effective blood flow during CPR. A good way to remember this is to think of the beat of popular songs like "Stayin' Alive" or "Baby Shark," which match this tempo. Always aim for both the correct depth and rate to deliver high-quality compressions. Question 7. You are caring for a choking adult who is conscious and coughing forcefully. What should you do? A. Give 5 back blows. B. Perform abdominal thrusts. C. Encourage the person to continue coughing. D. Start CPR immediately. Answer: C. Encourage the person to continue coughing. This question tests your understanding of initial actions for a conscious choking adult. If a person is choking but can still cough forcefully, it means their airway is only partially blocked, and they are moving some air. The keyword "coughing forcefully" is a critical clue. In this scenario, you should encourage them to continue coughing, as their own efforts are often the most effective way to clear the obstruction. Only intervene with back blows and abdominal thrusts if the coughing becomes ineffective or the person becomes unresponsive. Your role is to monitor and support, not to interfere when the body is doing its job. Question 8. What is the most common cause of cardiac arrest in children? A. Heart attack. B. Stroke. C. Respiratory arrest. D. Sudden infant death syndrome, SIDS. Answer: C. Respiratory arrest. This question addresses a key difference between adult and pediatric cardiac arrest causes. Unlike adults, where cardiac arrest is often sudden due to a primary heart problem, children typically experience cardiac arrest as a secondary event, most commonly resulting from respiratory arrest or shock. This means their breathing stops first, leading to a lack of oxygen that then causes the heart to stop. Understanding this difference is important because it highlights the importance of providing effective rescue breaths early in pediatric CPR. Question 9. When should a rescuer perform a blind finger sweep to remove a foreign body from an unresponsive adult's airway? A. Only if the object is visible. B. Never. C. After 5 back blows and 5 abdominal thrusts. D. When the victim is unconscious. Answer: B. Never. This question is about a critical safety rule in airway management. A blind finger sweep, meaning sweeping your finger through the mouth without seeing the object, should never be performed because it can push the object deeper into the airway, worsening the obstruction. The keyword blind is your clue here. You should only attempt to remove a visible object with your fingers. Always prioritize maneuvers like chest compressions and rescue breaths for an unresponsive choking victim, and only remove an object if you can clearly see and grasp it. Question 10. You are performing CPR on an adult and a second rescuer arrives. What is the most appropriate action for the second rescuer to take? A. Immediately take over chest compressions. B. Call 911 again to confirm. C. Help with compressions and ventilations, switching roles every 2 minutes or 5 cycles. D. Wait for EMS to arrive before offering assistance. Answer: C. Help with compressions and ventilations, switching roles every 2 minutes or 5 cycles. This question covers team dynamics in BLS. When a second rescuer arrives, they should join in to help provide high-quality CPR, which includes assisting with both compressions and ventilations. The most effective way to do this is to switch roles every 2 minutes or 5 cycles of CPR, helping to prevent rescuer fatigue and maintain high-quality compressions. This teamwork ensures that continuous, effective CPR is delivered until advanced medical help arrives. For example, one rescuer can focus on compressions while the other manages the airway and delivers breaths, then they swap. Question 11. How long should you check for a pulse in an unresponsive victim? A. No more than 5 seconds. B. At least 10 seconds. C. No more than 10 seconds, but at least 5 seconds. D. Exactly 15 seconds. Answer: C. No more than 10 seconds, but at least 5 seconds. This question focuses on the time limit for checking for a pulse. When checking for a pulse, it should take no more than 10 seconds. However, you should take at least 5 seconds to ensure you don't miss a weak pulse. The goal is to quickly determine if a pulse is present or absent without causing unnecessary delays in starting CPR if needed. A delay in beginning compressions can significantly reduce the chances of survival. Think of it as a quick, decisive check to move on to life-saving interventions promptly. Question 12. What is the first step you should take when you find an unresponsive person? A. Check for a pulse. B. Activate the emergency response system. C. Ensure the scene is safe. D. Open the airway. Answer: C. Ensure the scene is safe. This question asks about the absolute first step in any emergency situation involving an unresponsive person. Before approaching any victim, the rescuer must always ensure the scene is safe for themselves and the victim. The keyword first step emphasizes its priority. You don't want to become a victim yourself. For example, if someone collapses near a busy road, your first action is to move them or yourself to a safer location, or call for help, before directly interacting with them. Always prioritize your own safety. Question 13. What is the proper hand placement for chest compressions on an adult? A. On the lower half of the breastbone. B. On the upper half of the breastbone. C. On the xiphoid process, the tip of the breastbone. D. Anywhere on the chest as long as it's forceful. Answer: A. On the lower half of the breastbone. This question assesses your knowledge of correct hand placement for adult chest compressions. The proper hand placement for compressions on an adult is on the lower half of the breastbone, sternum. This placement ensures that the compressions are delivered effectively over the heart without causing injury to other organs like the liver, which is below the xiphoid process. Think of drawing an imaginary line between the nipples and placing the heel of one hand in the center of the chest, then placing the other hand on top. Question 14. How should you open the airway of an unresponsive victim with suspected neck or head trauma? A. Head tilt chin lift. B. Jaw thrust maneuver. C. Lift the neck. D. Turn the head to the side. Answer B. Jaw thrust maneuver. This question focuses on airway management for a victim with potential spinal injury. If you suspect a neck or head injury, the jaw thrust maneuver is the preferred method to open the airway because it minimizes movement of the head and neck, helping to prevent further spinal damage. The keyword suspected neck or head trauma is the crucial clue. In contrast, the head tilt chin lift maneuver moves the head significantly, which could worsen a spinal injury. Always use the jaw thrust if trauma is suspected to protect the spine. Question 15. What is the recommended depth of chest compressions for an infant? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters. D. At least 2.4 inches 6 centimeters. Answer B. At least 1.5 inches 3.8 centimeters. This question differentiates compression depths for infants from adults. For an infant, the recommended depth of chest compressions is at least 1.5 inches 4 centimeters or about 1/3 the depth of the chest. This depth is appropriate for the smaller body size of an infant to effectively pump blood. For example, when performing compressions on an infant, you would use 2 fingers to achieve this depth. Remember that proper depth varies by age, so always apply the correct technique for the age group. Question 16. What is the primary purpose of continuous chest compressions? A. To deliver oxygen to the lungs. B. To remove foreign objects from the airway. C. To create artificial blood flow to the brain and vital organs. D. To stimulate the heart to beat on its own. Answer C. To create artificial blood flow to the brain and vital organs. This question asks about the fundamental goal of chest compressions. The primary purpose of chest compressions is to create artificial blood flow to the brain and other vital organs when the heart is unable to do so effectively. Without this circulation, organs quickly suffer damage due to lack of oxygen. The keyword primary purpose highlights the most critical function. Think of your hands as acting like the heart, pumping blood manually to keep the body's essential systems alive until help arrives. Question 17. How can you effectively deliver breaths using a bag mask device for a single rescuer? A. Pinch the nose, seal the mouth, and squeeze the bag. B. Hold the mask in place with one hand and squeeze the bag with the other. C. Place the mask over the face, use 2 hands to create a seal, and have a second rescuer squeeze the bag. D. Use the EC clamp technique with one hand while squeezing the bag with the other. Answer D. Use the EC clamp technique with one hand while squeezing the bag with the other. This question addresses the technique for using a bag mask device as a single rescuer. For a single rescuer, the EC clamp technique is recommended to hold the mask on the face to create a tight seal, while the other hand squeezes the bag to deliver breaths. This method helps ensure that air goes into the lungs rather than leaking out. Imagine making an E shape with 3 fingers on the jawbone and a C shape with your thumb and index finger around the mask to pull the jaw up into the mask, then squeezing the bag. Question 18. What is the correct action if you are alone and find an unresponsive infant who is not breathing and has no pulse? A. Activate the emergency response system immediately. B. Begin CPR, starting with 30 compressions, and then activate the emergency response system after 2 minutes of CPR. C. Begin CPR, starting with 15 compressions, and then activate the emergency response system after 2 minutes of CPR. D. Give 5 back blows and 5 chest thrusts before starting CPR. Answer B. Begin CPR, starting with 30 compressions, and then activate the emergency response system after 2 minutes of CPR. This question highlights a key difference in the BLS sequence for infants when you are a lone rescuer. For an unresponsive infant found alone, who is not breathing and has no pulse, the priority is to begin CPR immediately, starting with 30 compressions, and then activate the emergency response system after 2 minutes, approximately 5 cycles, of CPR. This is because respiratory issues are often the primary cause of cardiac arrest in infants, and early compressions and ventilations are crucial. Think compressions first for adults who collapse, but CPR first, then call for infants if you're alone. Question 19. When should you administer naloxone, Narcan, for a suspected opioid-associated emergency? A. Only if the person is awake and responsive. B. When the person is unresponsive and has pinpoint pupils. C. If the person is unresponsive and has signs of opioid overdose like slow, shallow breathing or not breathing. D. After 5 minutes of CPR. Answer: C. If the person is unresponsive and has signs of opioid overdose like slow, shallow breathing or not breathing. This question focuses on the appropriate use of naloxone in opioid-associated emergencies. Naloxone should be administered when a person is unresponsive and shows signs of an opioid overdose, such as slow, shallow breathing, or not breathing at all. The key clue here is the combination of unresponsive and signs of opioid overdose. Naloxone can rapidly reverse the effects of opioid overdose and restore normal breathing, but it is not a substitute for CPR if the person is in cardiac arrest. If the person is still breathing adequately but drowsy, continue to monitor them. Question 20. What is the purpose of allowing complete chest recoil during CPR? A. To allow rescuers to rest between compressions. B. To allow the heart to refill with blood between compressions. C. To prevent injury to the sternum. D. To make compressions less tiring for the rescuer. Answer: B. To allow the heart to refill with blood between compressions. This question tests your understanding of the importance of full chest recoil. Allowing complete chest recoil means letting the chest return to its normal position after each compression. This is critical because it allows the heart to fully refill with blood, ensuring that enough blood is pumped out with the next compression. Incomplete recoil reduces blood flow, making compressions less effective. Always ensure you allow the chest to fully recoil before initiating the next compression. Think of it like fully opening your hand before making a fist again to grab something. Question 21. What is the most effective way to relieve severe choking in a responsive adult? A. Chest thrusts. B. Back blows. C. Abdominal thrusts, Heimlich maneuver. D. Finger sweeps. Answer: C. Abdominal thrusts, Heimlich maneuver. This question asks about the primary intervention for a severely choking, responsive adult. The most effective way to relieve severe choking in a responsive adult is to perform abdominal thrusts, also known as the Heimlich maneuver. The keyword severe choking indicates that the person cannot cough effectively or make sounds, meaning the airway is significantly blocked. These thrusts help to create an artificial cough to dislodge the foreign object. If abdominal thrusts don't work, you can alternate them with back blows. Question 22. You are using an AED on an adult. The AED advises no shock advised. What should you do next? A. Remove the AED pads and wait for EMS. B. Perform 5 cycles of CPR and then reanalyze. C. Check for a pulse and breathing. D. Resume chest compressions immediately. Answer: D. Resume chest compressions immediately. This question focuses on the correct action when an AED advises no shock advised. If the AED advises no shock advised, it means the person either has a heart rhythm that doesn't need a shock or has no electrical activity. In either case, the most crucial action is to immediately resume chest compressions to maintain vital blood flow. The AED will prompt you to reanalyze the rhythm after 2 minutes of CPR. Remember, even if no shock is needed, continuous, high-quality CPR remains essential. Question 23. What is the recommended compression to ventilation ratio for 2 rescuers performing CPR on a child? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. 10 compressions to 1 breath. D. 5 compressions to 1 breath. Answer: A. 15 compressions to 2 breaths. This question tests a key difference in CPR ratios for children with 2 rescuers. When 2 rescuers are present for a child, the recommended compression to ventilation ratio is 15 compressions to 2 breaths. The keyword 2 rescuers is important here, as it allows for a higher number of breaths relative to compressions compared to single rescuer adult CPR. This adjusted ratio provides more ventilations, which is important because respiratory issues are often the cause of cardiac arrest in children. Question 24. What should you do immediately after administering an epinephrine autoinjector, e.g., EpiPen, to someone experiencing a severe allergic reaction? A. Have the person lie down with their feet elevated. B. Call 911 or activate the emergency response system. C. Give a second dose of epinephrine. D. Offer them water to drink. Answer: B. Call 911 or activate the emergency response system. This question is about the crucial step after administering epinephrine for a severe allergic reaction, anaphylaxis. Even after giving epinephrine, it is vital to immediately call 911 or activate the emergency response system because the person's condition can worsen or the medication's effects may wear off, requiring further medical attention. Epinephrine is life-saving, but professional medical care is still necessary to manage the reaction and potential complications. Always prioritize getting advanced medical help on the way after using an autoinjector. Question 25. What is the safest position for an unresponsive, breathing adult who does not have a suspected spinal injury? A. Lying flat on their back. B. Sitting upright. C. In the recovery position, on their side. D. Face down. Answer: C. In the recovery position, on their side. This question addresses the appropriate position for an unresponsive but breathing person without a spinal injury. The safest position for an unresponsive, breathing adult who does not have a suspected spinal injury is the recovery position, which involves rolling them onto their side. This position helps keep the airway open by allowing fluids, like vomit, to drain out of the mouth, preventing aspiration into the lungs. If someone is breathing but cannot protect their airway, turning them on their side can be life-saving. Always ensure the airway remains open and clear.